When I first came to UK, really the overriding thought or theme in my mind was this is a place where people are serious about their work, they're serious about education and patient care, but they really do care about each other.
The culture here really was something that stood out to me, and we're just a very collegial environment. That was something that I really found special at UK. It's everything that I had expected and a lot more.
Graduate medical education is really central to the mission of the college, to see that whole spectrum of how we get somebody ready to fly on their own as an independent physician. It's just so key with our overall platform of who we are as a college.
When you first start here at UK as a resident, you get that hands-on experience immediately.
All right, so today it sounds like we're gonna do a right cochlear implant. Do you have any questions before surgery?
When I started as an intern on surgical oncology, I remember I was just doing what I thought were small cases, you know, level appropriate cases. But then at the end of the day, I was like, I cut out someone's cancer today. It was just crazy to think about. Now I'm actually doing my dream job.
The clinical training has really been top-notch. I'm getting to do cataract surgery, earlier than the vast majority of residents in the country.
We have an incredible track record. Over the last 10 years, we have just had exponential growth in our subspecialty training opportunities that we've offered. And so in offering these advanced opportunities, what we hope and what we've seen is that we are much more likely to retain Kentuckians in the community and other places in the state to provide that advanced care to the Commonwealth.
Training at UK offers the best of both worlds. You're in a collaborative and supportive learning environment, but you're also at a big academic center with lots of learning opportunities. I knew that I would get incredible training and be able to learn from experts in multiple fields, but I also saw that they worked so well as a team. I saw that UK was the best place that I could train.
We want to make sure that they can go out and be prepared to face really anything, and one of the blessings of being part of a large academic institution is we have those resources to provide those opportunities.
I think it's really important to make sure that you're going to get training somewhere that you are going to see it all. Here at UK, you'll be at a level 1 trauma center seeing lots of high acuity cases, getting referrals from lots of hospitals around the state for very sick patients.
We keep innovating in the way we train physicians.
We also have lots of simulation learning, and they're always developing new ways that we can practice certain techniques.
We try to bring in people from all different kinds of areas. We have people from private practices coming to talk with us about the finances of building a practice and sustaining a practice, so we don't just get the academic side of things.
It's really cool to see the growth that I've had since I started here. When I started, I was not very confident. Now I know I'll be really ready to take flight on my own after I finish.
I would definitely choose UK again, in a heartbeat. I've just been really happy with my time here.
If you choose to do your residency training here at UK College of Medicine, you're going to get great experience with patients. You'll get to learn from experts, and you'll also get to meet so many incredible people, both residents and attendings, that will become lifelong mentors and friends.